peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
Good morning, viewers. This is Daytime Express, broadcasting from Punchline Africa Television, broadcasting all the way in Nairobi, Kenya, the miles away in the political command center of Punchline Africa Television. I'm Dr. David Matsa. In the studios right down in Nairobi, we have Miriam Ogutu, our chief of all chiefs. So yesterday, people were complaining, I have not done gender parity. Somebody was on my case. Another lady said, no, you must have gender parity. But people have a problem anywhere. When there are fruits on a tree, they hit the stones to make the fruits grow. No problem. I will look for gender parity. I don't know what Miriam thinks about it. Welcome. Good morning, Miriam Ogut.
A very good morning to you, Doctor.
Across in Kisumu, I will introduce our senior in academics later. He's the last person to be introduced. You don't introduce youngsters whom we are mentoring last. Across the bridge in Kisumu is none other than Alomba Samson Onyango. Is our correspondent of Legacy Trend. Good morning.
Good morning, Doc. Good morning, Prof. Good morning, Miriam, our viewers. I take this opportunity to welcome you to our show, a show like no other. From Kisumu, welcome. Don't go too far.
Okay, there you are. We are getting there. Good morning, Professor Gerard Onyari, all the way from the CBD in Nairobi. Wherever you are in the command post of all flags that fly behind him. The Pan-African guy himself collects flags every day. Thank you for copying the symbol. I am on scarves. Thank you. Kenya, Zimbabwe. If you have a flag of your country, send it to me. I'll give you the address where to deliver. Send it to me. I need all these flags. Stop wearing the flags of Chelsea. Which a club you don't know where it's located, where. But where the flag of Africa, where you know. So thank you very much, Professor Gerard Onyari, with your flags behind you. Good morning, Professor.
Good morning, Dr. Masanga, my fellow panelists and our viewers.
We won't take much time. We go straight to the subject. COVID-19. Media, break the figures.
All right. Thank you so much, Doctor. And as we speak today, Kenya, the confirmed cases stands at 13,353. The death toll is 234. Recoveries right now stands at 5,122. And Uganda, the cases is at 1,065. Recoveries is 1,025. And South Africa, 364,323 cases have been confirmed. The death toll is 5,033. Recoveries is 191,059. And we look at the total cases in Africa this morning is 702,663 cases, and the number of deaths in the continent is 14,956, and recoveries right now stands at 367,652, and the global cases are over 14.6 million. The death toll is 608,978,000, and the global recoveries is 8.7 plus a million people there have been able to recover globally.
Thank you very much, viewers. You can see for yourself. Miriam, when you are reading Uganda, I want you to emphasize the point that it is the only country in Africa, or maybe the world, that has not had any death related to COVID-19. Because there are people misinterpreting and talking rubbish around this place. Or here you hear someone arguing that, oh no, Uganda people have died, or this. No, the official statement from President Museveni, the government of Uganda, the 40 to 50 professors of medicine, of public health, of social distance, those all who sit near Museveni have confirmed no Ugandan has so far died of COVID-19. And that is a fact. We don't need to lie in order to eat.
No, President Museveni has been very transparent in the manner in which he's been handling COVID-19. I think in the continent he's been doing very well. And of course, I think Ugandans also have been able to cooperate with what the government is saying. And in Kenya, also President Uhuru Kenyatta has been doing very well, and the Ministry of Health. The problem is with the Kenyans who are not willing to cooperate and do their part in able to curb COVID-19. So in Uganda, the government has been very transparent on giving the information and the updates they've been giving. So, yes.
Thank you very much, Miriam. The COVID situation in Uganda, the COVID situation in Uganda is such that it's a miracle. There's no much reproduction. There's no much reproduction. So this is just a miracle. Either people took to they took the guidelines seriously and started washing hands. And to be very frank, even my own mom, God forgive, she's 90 years old. God has kept her, and pray God continue to keep her. With this type of thing, she still has her original situation of her own sickness, but this thing has not come in yet. So Uganda seems to have a different place scenario because of the strictness. The government is strict, the president is strict. I swear you play with it, you can play with anything. You can smuggle what you want to smuggle. But if you smuggle one case of COVID-19 in Uganda, it is like a suicide case. You are going for bullets. That's the truth. And the man has made it very clear that there is no need of playing with people. Don't play with people's lives. Here we have people's lives being played about. Here we have senators drinking and being caught while drinking, and yet they make the rules for the ordinary people to hear. Here we have people going to hold public rallies without masks. Whichever side you belong to, I am not concerned. I'm concerned about Kenyans. I'm concerned about a Kenya that can be and live together. I'm concerned. I'm concerned about how people will collapse and there will be no Kenya. So don't blame me. Don't blame me. Blame yourself. Don't blame me for shouting every morning at 10 o'clock about COVID-19. Blame yourself with your bad manners, bad behavior of not washing your hands. Then the disease come but find you with the hands washed. God helps those whom help themselves. God does not help those who are lazy. As Museveni said, God has so many other duties to solve. The whole world is in chaos, nuclear weapon in North Korea. Yeah? Chinese are manufacturing swine disease again. There's a lot of work for God to do. You want the churches to go and pray. Yesterday the churches were open, they were empty. Nobody went there. That is very good, so that people fear. Because how will you regulate the church? You can regulate a hotel. And not every hotel, 5-star, 6-star hotel, can be regulated. Because every point of the hotel, you see, every point of the hotel, there is somebody standing there to make sure that you don't miss the sanitizer. But you cannot have politicians running the whole country, spreading gossip. And the people they are spreading gossip to have no masks. And they have the masks. Seriously, let's think about it. You might call me a bad man, a bad mouth. That is okay, fine, it's all right. But I'm saying the truth. I rescued one of my children. I healed one of my daughters. Beautiful daughter, 28 years old. I had to struggle. I went down, I was looked at so many ways. I am very far from her, and then she's not well. How will I fly? You saw the stress, the amount of stress I was in. And the restrictions are, the barrier is just now. Some countries are very strict. You can see the type of life I was in. So, but I struggled and I said, do this, wake up, do this on video. This thing is real. Go and cut the oranges, cut the lemon, cut this, hot water, take this, take that, no medicine. Now I'm glad that medicine has arrived in some of those places. People are beginning to go to the chemist and pay 10, 12 pounds to buy. So when I'm talking about this, is seriousness from the bottom of my heart. This thing is there. Let's try to avoid it. Stay safe. Wash hands. Wear a mask. I think all that is what I can say. Let's move on.
Yes, and we've seen on the front pages here on the Daily Nation, before we get to the politics of it, on COVID-19, Nairobi by night, bars and clubs breed COVID. Now, on an ordinary Friday night, Nation senior editor Caroline Junge would be nestling in her house with her family. Last Friday, she went on the prowl in Nairobi, hopping from one bar to the next, and then the horrifying stories of how Kenyans are behaving badly in the face of an approaching COVID storm is carried out on page 4 and 5. And we were watching, I think, was it on one of the television stations, and they were doing the same story there. Bars were opened, Doctor, and they were filled to capacity, so I'm not surprised. Well, I was surprised that Sakaja also could find himself in that situation, being that he's one of the people who even were able to come up with these laws to help us, curb the spread of COVID-19. But Kenyans have refused to adhere to the social distancing. Kenyans have refused to pay attention to what they're being told. And these bars that are still operating, why are they operating? Does the police know that these bars are operating? Why are they still having their license on? Because we can't keep complaining about the same thing, and the people who are supposed to be taking action, the officials, they're not doing that. So what could be the solution to this, to these bars and these establishments that continue to flaunt these rules that have been put forth by the government, Professor?
Thank you, Miriam, for that question. We have pronounced ourselves and we will continue to do so. We will never give up until telling Kenyans what to do. Protocols have been put in place. We are facing a pandemic. Corona is killing and it's becoming a reality. We can postpone drinking. We can drink some other time. But this greed for social jointing and the greed for making money at the expense of this coronavirus, you wait. The way you are being warned by the expert, by September, people will regret why they did this kind. They were able to do this kind of action. And remember, when you go to the joints to relax yourself, Remember, from there you are taking to your family. So for heaven's sake, the Ministry of Health, World Health Organization have given protocols. Our appeal to Kenyans, please let us follow these rules. You are not doing anyone any favor. You will get killed, you will kill your family, you will kill people who are close to you, and you will kill innocent people. So let them just follow the protocols which have been given by the government, and by the help of God, we will slay this dragon.
All right, thank you, Samson there. Why is it so difficult for some Kenyans to follow these rules that are meant to safeguard themselves and the people that they love?
Thank you so much, Miriam, for your question. First of all, Miriam, if you permit me, over the weekend we lost one of the biggest TV gurus, one Papa Shirandula, somebody who has given so many Kenyan inspiration. So if you allow me to send my message of condolence with friends and fans all over the world. May God rest his soul in peace. Now, to your question, Miriam, people have been talking about return to normalcy. People have been talking about, let us open the church, let us open the clubs, let us open, and it begs the question, what is so big about going to church? What is so big about going to about politicking? What is so big about going to clubs? What is so big about drinking that is bigger than the lives of Kenyans? That is bigger than Kenya itself. So I think Kenyans should just should talk to their own conscience and ask themselves, is drinking bigger than their own lives? Miriam, we are setting a very bad precedent. The Ministry of Health pronounced itself when we first of all got the very first case of corona. They gave their guidelines, but here is a case whereby there is violations of those rules, flouting of the rules are happening, being executed by the leaders who swore to espouse and protect the law. Miriam, in terms of crisis, I just asked the president, this is time for us to create a correctional facility to deal with these particular leaders who are flouting the rules of COVID. We need to bring this behind bars, because Miriam, every Kenyan has got an inclination towards politics. If my leader, for example, is flouting rules and going with it, getting away with it. For example, we saw over the weekend, former Senator Wetangula was flouting the rules. There was a time he was arrested. When he was released, he called for a rally to celebrate the release. These are not the kind of leaders we should have. Let us create a correctional facility to deal with people. Thank you. Miriam, I'm not very happy this morning. We have a country to protect. Thank you. Back to you in studio.
All right, thank you so much. And as just what you just said there on the front pages of the Standard newspaper, just up there, a top civil servant helps Sakaja escape arrest. And it says a scheme, Nairobi Senator Johnson Sakaja, who was found partying in a bar after curfew hours, was to report to police on Saturday, but went into hiding. A police top official is shielding him. I don't know how long Mr. Sakaja, our Nairobi Senator, intends to go into hiding, because I assume he shall find his way to the Senate. He's supposed to be going there as part of his work there to debate on and to carry out his oversight role there as a senator. What a shame. This story is just very, very, very shameful. And to think this is one of the people who, a doctor, sat down and thought, let's put these measures in place so that Kenyans are able to be safe. And he's one of the people who went ahead and flouted these rules. And then on top of that, now it is being said that as a top civil servant is actually, is actually shielding him from being arrested. What is this?
Miriam, before you bring doctor, I want to bring out some issue. You remember, you remember Mr. Sakaja is a leader that has got a big following. People have been, the youth, like me, for example, they have been looking up him. he has a responsibility to obey the role.
Are you disappointed? Are you disappointed as a young person?
It doesn't, as a young person, I look up to him. I've got political inclination towards towards politics. So if my leader like Sakaja, who should be bearing the greatest responsibility to espouse the principle of our constitution, that is patriotism, is leading in floating those roles, I am a very sad young man this morning.
All right, thank you so much, Doctor. Should Sakaja face the law?
Yes.
Absolutely.
He's my friend, but he has behaved very badly.
Absolutely.
That's it. And for those of you this side of the world, it is breakfast time. That's why I'm having a bit of breakfast. I want people to appreciate that this side of the world where I am, it is a breakfast time. And usually the show catches me when I'm just having breakfast. So good morning, Africa. Thank you very much. Daytime Express. I agree with Aromba and Samson, Miriam, and the professor. The law must take its course. In fact, for me, I'm going by the end of this show. I'll tell you the name of the civil servant who was shielding him. That's it.
Right.
Senor, me, I'm Mr. Hammer. I want to tell the name. Yes. The police, you forget when you come to near Sakaja's phone. The track record, the tracking device indicates the number of the person who ferried the Sakaja from the phone. You know, because technology now has brought us, you can hide, you can steal, you can do anything, you can kill people, but you leave a mark where technology will begin from. So yesterday when these people waited at Sakaja's home and they couldn't turn up, they went back to the police, to the Safaricom and said, what about how many phones were in that compound before? And that's where they landed on one of the phones. Then the civil servant is saying, please hold, I will produce him. I will produce him.
But also, Doctor, something I don't understand. This person was taken to the police station. Why is it that the police also broke the law? The same police who are now looking for him. They did not, if you're booked into a police station, you have to be booked into the occurrence book. He was not booked. And then they released him and they're hoping he'll come back. Or yeah.
Miriam, he was. I've seen the occurrence book.
That must have been done later because even Sakaja himself tweeted.
No. He wasn't, you know, Sakaja was trying to say he was never in the police station.
Ah, okay.
Because there was still brandy sinking in the, brandy and the whiskey sinking in the now.
So he was not aware the police booked him.
Yes.
But this process of now they're looking for him to complete his release. Why did they release him without the due process, without him following the procedure and how, everybody else, when you're booked there, any Kenyan or anybody who, when you find yourself in the police cell, if you were released even on bail, I think there's a process to that. And also the police floated that part. So they released him and he was to come back and complete that procedure. How? That is not how the law works here. He should have been treated the same way everybody else is treated because he's risking not only his life, but lives of so many Kenyans. And people like this, the leaders like this, they should be used, I don't want to say as a deterrent, but yes, because if in their position, they're the ones who are acting with impunity, what do you expect from the ordinary Kenyans? They're encouraging very bad manners, and so the law, I think, should come really and take its course on this matter.
Miriam, Dr. Masanga has rightly said that you can run, but you can have nowhere to hide. Mr. Sakaja, Senator Sakaja, he knows the law, he registrates very well. To go to be arrested by the police, let us not try to say that the police The police can give you a bond, a bail, so that you go and you come and report. So the boy was expected to come back and report. But it's very unfortunate. I did say that him being the chairman for COVID in the Senate, the first thing he should say, we should have seen him apologize and resign from that position and appear before the court of law and mitigate the reasons as to why he was doing that. The civil servant who is shielding him should be brought to book and be asked to resign. This is a shame. You see how Samson is trying to say. These are the people who are supposed to mentor the young people. When the young people come to realize that the laws are not being followed by every member in the service, they will also take their laws into their hands. This is a country of rule of law. There's a culture wherever he's from, wherever he's hiding from, come out, go to the police, go to court, he will get a bond and he will come out, and life goes on. It's very unfortunate. We are taking a lot of time to discuss this, but these are the kind of people who spoil the name of the government, even when the government is not even involved. He was found drinking in the wee hours of the night. He broke the curfew laws. It's not, so many people have been arrested and we have not seen them running away.
And also, Miriam, there is a tweet that was made by the same individual, Sakaja Johnston. He said in the tweet, never been arrested, won't be arrested. Show me an OB number. Can you, like, if you listen to the message itself, it's very clear that he has never been arrested. He won't be arrested. And if at all he has been arrested, then let whoever is alleging that to show the OB number. These are the kind of, this is the height of recklessness. That should not even come from a senator who is chairing a crucial committee parliament. I am just sad.
Disappointed. Yeah. And then he goes ahead and thumbs his nose to the law. He really is acting there with impunity. And also another news to do with the COVID-19. Anxiety gripped residents after the first case of COVID-19 in Tana River County was announced by Health Cabinet Secretary Mutahi Kagwe. The man who died on Thursday of diabetes complications at the Hola Referral Hospital had also tested positive for coronavirus after his samples were taken. So what happened? More than 50 people, including doctors, nurses, and Tana River County officials who came in contact with the patient, have been isolated following the announcement of the COVID case in the county. Dozens of patients who were in the same ward with the man fled to seek treatment in other private hospitals, sparking fear the virus may spread. And also other people who are other patients also who are in the same hospital just ran away. There's still a lot of stigma when it comes to COVID-19, and that's why sometimes people are very afraid to come out and go get tested. What can we do in terms of improving our level of understanding and comprehension on what really this COVID-19 is and how it is spreading, so that Kenyans are not really, because now they will be afraid even to go there if at all they have malaria or other illnesses that require medical attention. They will be afraid to go there to seek treatment, thinking because a person was here and had tested for COVID-19, now the whole place is just full of COVID-19. How can we allay such fears, Doctor?
Unmute, Donna.
Professor, go ahead.
Oh, sorry.
Yes.
Civic education. Civic education is very important. And we have not had civic education. Miriam, most of the NGOs eat the money, but they don't educate the masses. This is like elections here. Even during elections in this place, we are supposed to educate our voters should cast their vote and go. There's nobody who educate people. Everybody, you only see NGOs at the court. All of them filing amicus curiae, amicus curiae, amicus curiae, amicus curiae, amicus curiae. But when it comes to educating, you don't see them. So this is a community TV. We better call upon the civic educators to come up and help voluntarily to even now stop stigmatization of the people in particular area. That's all I can say. Professor.
Yes.
Yeah. Miriam, we have done extremely very well as a country. This is something new which came. We have come with rules and protocols, and the way the doctor said is that a lot of awareness to synthesize people, the public health officers, now that we cannot be able to have gatherings. And the reality of the case is here, even when the minister reads, he reads that these are the confirmed cases, these are the people who have been healed, and these are the people who are dying. With or without corona, people are dying. So corona is not a certificate that when you get it, you will die. So this message needs to sink to the people. Let us use the radio, the TV, the FM stations, so that people get awareness that corona is just like another disease. You get it, there is a hard interventions, you get well. So people should not be stigmatized because they have got corona. So more messages need to be done. And that's why Dr. Masanga said that the minister, the cabinet secretary for health coming to tell us about the figures is not enough. That is the opportunity to have various professionals, social distancing, those who can do psychology, those who can do counseling, so that they can be able to give the people this kind of message so that people come to have it. So what we need to do, like yesterday I was reading and people are trying to say, you see, was sitting in Busia, wanasema hiyo ni ugonjwa wa Nairobi. So more needs to be done, more needs to be done. And remember, my friend, Miriam, health is a devolved function. So more of the county government leadership should be able to carry this, castigate it even to the county wards and even the village level so that people get the message.
All right, thank you so much. And so now I think, Doctor, we turn our attention to the rest of the news making headlines on the top newspapers. That is the latest there in terms of COVID-19. And as you said there earlier, Kenya right now stands at 13,353 confirmed cases. The death toll is at 234, and recovery rate right now stands at 5,122. And the cases there continues to go up. So we will continue appealing to Kenyans to please be disciplined. I think it all boils down to discipline, and we have a lot of, especially these young people around here, quite indisciplined. So I'm just, that will be our appeal, and that is what CS Kagwe has been trying to do. And he came up the other day, Doctor, with another slogan that says, I protect myself and then I protect you. Like, you have a responsibility to protect me and I have a responsibility to protect you. So can we just be our brother's keeper so that we can be able to all be safe and sound? And so we turn to the Daily Nation. No, the Standard. Yes. Doctor, you Yes? Yeah, you have something, Doctor?
Yes.
Okay. Go ahead.
If you were born in a household, it does not have, and you come to town to find a toilet with a flushing equipment, what do you do? Some people can continue flushing, the flushing so that the water again fills the whole place. What am I saying here? If you are picked from nowhere and brought and put in things that you were not expecting, normal democracies, people put you under very good counseling. Before you become a senator, before you become a chairman of a party that wins an election, I think the rest you people can conclude. I don't know whether Alomba has picked what I've said.
I don't know if
Mr. Alomba, you have. Can you switch on? Switch on. Yes.
And I can see that I don't know if those are the latest images, Doctor. I don't know if that is the latest images showing Nairobi Senator Sakaja heading there. I think that is Kilimani Police Station or something like that. He's going there yes. So those are the latest right now. He has decided to hand himself over.
They should not release him.
He should go to forced quarantine, Doctor, for maybe 21 days.
No, he should not be released. Until the court releases him with bail conditions. Me, I have no mercy with friends of this nature.
No, it is true. It is true, Dr. Masanga, that if he was given a free bond by the police and he has gone to hiding, even if the court gives him the bail or the cash bail or the bond, he has shown the indicators that he can not even go to court. So he should do the rest of his case when he's in custody.
You know, I've just told you a story.
Yes.
One of the problems of Jubilee Party is this man. We gave him power too young to handle. We promoted him too fast. At 22, 20 something.
30 what? He's 30?
He's now 30, but that
36,
time he was not fit to be a clerical officer. He doesn't know what a filing cabinet is. Yes. People, Bazungu, you know, there's one thing we hate colonialism. But these Bazungu are very good people. Jermaine, it's good they came to Africa a bit. They taught out so many good things which were thrown out of the window. A Muzungu could give an experienced man a job and leave a high flyer PhD holder without a job. There are people today who have several degrees, but they don't know what a file cabinet is. They don't have office manners. They don't know what health, safety and health regulations of an office are. And they want to become chairman of Nzoia Sugar Works. What will you tell the people? Youth of today, gentlemen, learn, get experience. Experience is the teacher. That was a saying. Sakaja just climbed from nowhere to somewhere. Therefore, he needs counseling. This problem is happening on him. Needs to go to a counselor. A counseling man who can sit him down. That if you have family problems, oh, God has told you quietly that you are about to die on 20th of January 2021. Tell us. In Britain, where we are now, where I am now, wherever I am, listen, Miriam, nobody, if you win 200 million pounds lottery, the check will not come to you more. They will show you a damage check. You know the first course you will do is to undergo counseling. Financial counselors, financial counseling agents, stress management agents, security management agents, community management agents. How many have I mentioned?
Financial.
If you have, those are 5. If you have children, social worker management in the house, because you can kill your children because you have 200 million pounds.
True.
You can even go and buy a car and start driving, kill people. Car management counselor, how to handle a car. Alcohol management people, alcohol management counselors, alcohol management counselors, alcohol management counselors. They come to your house like a bees. Then last year you have church management counselors. I am an elder on my church in the committee that goes to talk to some of Zungu. Said yesterday my wife left me. Now I'm thinking the only alternative is stand at the middle of the railway station, the railway line, and then the train ran over me. Then the train ran over me. Then you talk to him and say, my friend, there is life ahead. The Queen is going to announce some packages for your middle-aged. You tell him, what about trying to go for a holiday with me? Before they hand you that check, you undergo all those. Here, we got men, we picked them from the streets, eating changa, we put them straight. You know, they don't know how to handle women, they beat women, they are violent. I'm telling you the truth. When he now is up there, everybody is useless. Look at Kuria. Moses Kuria is another one. Another younger man who makes us laugh, who makes us very ashamed, who makes Alomba to be very ashamed. Whenever he sees Moses Kuria making news headlines, you want to hide. You don't want to associate yourself with him. That's why Sakaja has found himself in a mess. He did not have any experience. He even told you he just is the youngest man to enter parliament, Senate as he even showed you that, you know, when he bought his first Range Rover, he showed to everybody. You know, some of us bought a car in 1981. I had my own car, but I never showed it to anybody in the village. I never even drove to the village to see. But when he bought his Range Rover, he went parking. In fact, he could even tell you to remove your car from the parking lot in the hotel so that his Range Rover should be parked there. Alomba, I have a lot to tell you. If I tell you, you might not even ever look at his face. So some of us, as friends, we have suffered a lot with Sakaja. You know, you remember he started even one of those groups that started attacking the president. You remember? He attacked the president very badly until some of us went on him face to face. He said, we shall also now attack you. There's something wrong. Sakaja used to be big. Then he went to reduce himself. I think something is not right.
You're right. He's lost some weight. Maybe he's watching his weight.
That loss of weight is not very good. It wasn't a good proportional loss of weight. So we need to look at it. Let me remain with my weight until God calls me. I don't want to go into these other machines. There are some machines that squeeze out some liquid.
It's called liposuction.
I will never go there. Then why did God make me? Why did He make me like Aromba? Aromba eats the same food I eat, always stronger. But they are not as huge as me. So why am I fighting God? Why? As long as I don't have AIDS, I don't have what? Why should I go to those extents? Chunga AIDS peke yake. Ingine itakuja with uzee. There are some diseases that come as a result of a muzee. Yes, you are going towards 60. Me, I don't want to tell a lie. I'm going towards that age. So I have got to keep myself safe. I've been lucky. When I tell people that I'm 64, they said, where is the gray hair? You see, that's why I'm being belittled here by even stupid people. They think that I'm just 30, okay, 32, 34, 35. Because I grew well. I make my bed. I wash my pants. Yes. The cleanness of a man starts with washing a pan. Some men are very bad people. You iron your shirt, iron your cloth when possible. I used to do that. I don't leave my bedroom. Nowadays, I've slackened a bit because of age. But at the age of Alomba, we're stronger. My bed, my room, my bed sitter in Nairobi West, no, in Nairobi Langata, house number 286, Ngei Estate. When I was slender like this, was the best. That even any girl, smiling, tall girl, slender, arrives in the bed, sitter, would not like to leave. The pajamas kept here in the corner, handkerchief kept here, best kept here, shoes cleaned inside, down, kept there. When a girl arrives in the room those days, this is 1985 in Nairobi. We have been overthrown. We have no government, nowhere to go. Useless. But I kept my cleanness. When I saw the compound of the landlord, dirty, there was a very dirty wife in that compound. The woman could look through me in the window, say, is this, the guy is cleaning. I could clean the entire compound for free. With water, there was water those days. Not like now, things have spoiled. Piped water, you could open water in those areas of gay estate when they were new. The landlord, the man and the woman, they loved this guy. In a boys' quarters, that's where I stayed. Clean. That's the problem we have. Some of these younger men are not clean at all. They take 5 days like a wazungu without showering. Water has become a problem. When they pass near you, it is like you want to run to hell, to dive into Indian Ocean. Africans must shower. And if the chaplain is not preaching this, then he's not doing a good service. Community work involves community work involves showering, cleanliness.
Yes, cleanliness is next to godliness. Yes.
Your latrine must be smoked with banana leaves.
Huh?
Yes, you smoke with banana leaves so that smoke kills the maggots. That's what we used to do. Most of us did not grow up in the places where things were very smooth. That's why we have stayed longer here. You don't touch the food. Aki ya Mungu, my mom could not allow you to touch the food. She uses that stick of that thing here to feed you. Go and wash your hands. Nowadays, some of these guys come from the toilet in the Sacred Hotel. Hey, Dr. Matanga, how are you? Can I join your meat? I said, eat it. And before he says, can I join your meat? He has already grabbed one piece and I don't wash his hands. Your behavior inatoka wapi? Where is the behavior coming from? Then you blame Uhuru Kenyatta for the disease going up. You blame Mutahi Kagwe. You have gone to eat meat in a Sacred Hotel yourself. Someone comes from the toilet and you have watched him very properly. He passes the sink. Then he comes, oh, daktari, wacha nikule kidogo. Anahama nyama yako na ile mikono. And then, you know, twice people have done to me like that. And I've left the meat and I told the cook to bring me more. Weka ngine, mguu moja, yangu peke yangu. And my friends will say, are you not hungry again? Say, no. In fact, you and your friends, you can finish. I've just been called now. I'm going. They embarrass you. Avoid such manners. The Sakaja style can embarrass you.
All right, Doctor, thank you so much for that.
No, I'm embarrassed about Sakaja. I don't know how I will meet him again.
It is embarrassing.
Because I'm his friend. I'm not supposed to be here. And I'm equally embarrassed about the man keeping him. I've just sent the name. I've sent a message to the man keeping him. That's why you see him there being taken. We said, I'm going to call you on the media now. I don't care. Top civil servant, my food. Nyenye waizi. Waizi. These are thieves. You want to be a president, the name stupid. Very stupid people. When I review His Excellency the President, the name, when I'm jina kabisa. We are trying to clean the president's name. They spoil the name. Every day, at the top civil servants, we shall publish him. It's good he has listened to my telephone and sent Sakaja there. I said, boss, the rumor is that Sakaja is in the house. You take Sakaja there. Nyinyi mnaharibia president jina ya nini? Do you remove him from the Hague? You. Mlimkuwa mnamuacha akufe. You wanted him jailed. Some of us have to stick our name, but we don't go on bragging and taking credibility, enjoying the fruits that some of these so-called civil servants are enjoying. Wallahi Mungu is very painful. I'm not a Kenyan, but I am pained. I have never enjoyed. nitamtopu civil servant. Civil servant ni nini? Nimumpigia simu wewe. Atuelewe. Send this guy to the police. Mnaharibia president jina every day. Kwa nini? The man is working so hard to put up a country of a united Kenya. Who is he? Every day stealing. You give them something, they hide the money, they buy cars. Mzee, watu wamechoka. Miriam, you saw me when I woke up, I went to do what? To make a call. And I did. And if he says, nah, I'm going to name him now. Sugudi has just taken Sakaja to the police. Such silly mistakes. If you want to drink such a drink, go to the hotel, Radisson Blue. Book a room. If God told you that you must drink until morning, book a room, sit at the counter. They will close the outside for anybody coming. You can drink and collapse in any hotel. Then you go and shower in the morning, drive home. But you can't go to a public place where everybody will see you. For us, as long as it takes a quarter past 8, I'm already in my house. I don't want to have a problem. The earthquake, the Rift Valley has broken, and then the car finds you on the other side. Then 9 o'clock is applying up. The police will not know there's an earthquake that side. I want to take my time and be in the house. I've never in this 4 months or 5 ever broken one. Being, even when I've never, I only go out on necessary, let's see, to see the town, for example, how the town, as an investigative journalist, how the town is working with Major General Badi at night, how those younger men are carrying stones. By the way, Miriam, you better bring that story. How the president is working so hard, how the roads in Nairobi are being transformed.
We can look at the legacy tomorrow, Doctor, and just see what has been happening.
Thank you, but iyo muchunge. Now the matter is solved. Iyo mesha solved. Sorry, thank you, Miriam. I gave the phone to him. Said, mzee, tunakuja sasa. Tunataka kupiga picture na wewe na family yako. Release the guy to go. Wacha. Mnaharibia president jina kabisa. Thank you.
Right, thank you so much. I think, for the interest of time and the other topic that we have that is quite broad, perhaps you say just on COVID-19 and what is happening, Professor, and then, more Samson, and then we can finish. Or Samson, and then Professor. Samson, go ahead.
Yes, thank you, Miriam, for the opportunity. Miriam, there was a time you talked about, do we call it stigmatization of the people who are already victims, who are already infected with this particular menace? People are really stigmatizing them. I want to say this to our viewers. As a country and as a continent, we have come from worst diseases, the likes of corona, malaria, the likes of AIDS, some of which we still live with. So corona is just one of the diseases that we are bound maybe to either fight it and win completely or live with it at the end of the day. So just like Prof said, if anyone unfortunately gets this particular disease, that is not a certificate that is not a death certificate. We have cancer with us, we have cancer patients, we have AIDS patients. Why do we want to victimize people? Why do we want to stigmatize people? Because at the end of the day, with this particular pandemic, everybody is a student. Everybody is a student. So let us rise to the occasion, support our brothers and sisters who are already battling this particular menace, and have general view change with regards to our patients. Thank you. With that, I know at the end of the day we shall win this particular disease.
Well, thank you so much, Prof. Before we jump into the next...
Yeah, let me just add this to say, Miriam. Coronavirus is a pandemic. We have seen how it has devastated some countries like Italy. See what's happening in the United States of America, Spain, Brazil, and many more countries. My appeal to Kenyans here is, let us team hands. Let us fight COVID-19. Let us wash our hands with soap and water oven. Do it at least 20 seconds as we are being advised. Let us avoid the crowded area and keep social distance. Let us cover our mouth and nose with a tissue or a handkerchief when we cough or sneeze. Let us stay safe, and this one starts with you and me. And with the help of God, other people in the past have gone through a pandemic, and we will go through this pandemic if we keep these simple rules. Dr. Masanga said it is just hygiene. Wash your hands. Stay away from crowded places. Don't sneeze anyhow. Wear a mask. Then we are home and dry. Thank you.
Thank you so much there, Professor Onyari. Doc, do you have anything else to add? All right, so thank you so much. This has been Daytime Express. We shall see you on our next show, which is supposed to be Diplomatic Clicks, where we shall look at, yes.
I'm sorry I muted mine.
Okay, yes.
We shall be doing the legacy trend tomorrow. The successes of EACC. The results, how many people, how much money they have recovered, and what can they do to recover more, and which way forward. Looking at the case where the DPP won that he cannot disclose what he wants from a suspect. You remember that case? So that is very, very important. Tomorrow we shall do it. Otherwise, I have no words. I just want to look at this new topic.
All right.
The topic in diplomatic leaks.
And the topic,
I can see,
yes.
Daniel has arrived on the scene, as usual, very well organized, and with Mr. Alomba. And the people are telling me that these two people are brothers. So I don't know. And that's all, Miriam. Thank you very much. I just, all the time, in pain, in sorrow, in goodness, I'll always love you.
Right, appreciated. Thank you. We'll see our viewers in the next after the break, and where we shall be looking at diplomatic leaks. Does Africa need elections during COVID-19? Don't go too far.
It is ridiculous and it is against the laws of nature that we can have somebody sitting pretty who takes home more money than the credible entrepreneur who is doing actual production of goods and services.
We always say it as it is. It is only in this country that when a thief is arrested, you hear elders from their tribe saying, he is our son and he is our thief.
If you are deviant
Yes.
and I call you leader, probably you are already a leader, but you are leading in the wrong direction.
We want to see the role of the youth
Yeah.
in the security,
Yes.
governance,
Yes.
and development.
The youth that I meet and work with here, you know, we call them the millennials and X's and Y's, this and that. They don't necessarily want to live like their fathers and grandfathers,
Yes.
do business like their fathers and grandfathers. They're more independent, they're better educated, and they're the ones that are making everything move in this region.
We look at the issues, we talk about issues that impact people's lives in Africa. The African peoples themselves continue to cheer bad leaders, and because they cheer them on, they continue to be misled.
Let me ask you, doctor, would you rather be somebody who does not enjoy so much freedom but you are rich?
Yes.
Or you'd rather be poor who you are actually imprisoned by the poverty itself?
My goal is not to come here and say, I want the majority ownership, I want to own this, I want to own that, I want to do this. My goal is we all make money and we're all happy, and I help build a big business here.
Punchline is for Africa, with Africa, from Africa.